Good evening. My name is Rosemary Anachibaye. This is my integrative therapy video. I have with me my client, and he has consented to this confidential interview today. My client is a 45-year-old African American male. He's a successful corporate executive with a long-term history of depression and anxiety. This patient was diagnosed with depression 7 years ago after his first divorce and generalized anxiety disorder, GAD, a year later. He has recently remarried and is looking for non-pharmacological options of managing his depression and anxiety. He says he doesn't want to continue taking drugs for the rest of his life. This client has never disclosed any information about his condition to his family. He struggles to keep his medical condition a secret to the extent of skipping medication if he is staying with family. He is deeply afraid of being discovered as a weak person despite his corporate success. Even though he was diagnosed 7 years ago, he reports that he has always felt alone ever since he could remember, and experiences frequent bouts of hopelessness, constant worry, restlessness, and irritability. He blames himself for the first divorce and is worried he will fail again in his second marriage, to the extent of getting panic attacks. This client is also constantly worried that he will fail the family and destroy the legacy built by his father if he continues making mistakes. He has, in the past 3 months, been experiencing persistent headaches, hence the referral for better management of his depression and generalized anxiety disorder. The client wants to try psychotherapy to assist with his condition and help him open up to his new family. I will use integrative psychotherapy by combining 3 approaches: cognitive behavioral therapy, CBT, interpersonal psychotherapy, and supportive therapy. Cognitive behavioral therapy is a goal-oriented psychosocial intervention focusing on challenging and altering behavior and cognitive distortions such as beliefs, attitudes, and thoughts to develop coping strategies, according to Bat et al., Lemons et al. 2016. CBT will be utilized because of its focus on changing the thinking or behavior associated with the problems a person faces, according to Bat et al. 2013. The patient requires to change his thought process where he regards himself as a failure. Interpersonal psychotherapy, IPT, is focused on improving the quality of social and interpersonal relationships for a patient with mood disorders, according to Bat et al. 2013. IPT focuses on improving the transition experience and deal with interpersonal disputes. Hence, it is helpful for a patient who needs to adapt to the new marriage and improve his relationship with his family, according to Lemons et al. 2016. Supportive psychotherapy is a long-term therapeutic approach aimed at reinforcing the learned, healthy, and adaptive thought behaviors in a patient with mental disorders, according to Buckley et al. In 2015. In supportive psychotherapy, patients are engaged in a supportive and emotional relationships by their providers to promote healthy thought processes and behavior in their interpersonal relationships, according to Buckley et al. 2015. Given the patient's long history of feeling like a failure, fear of his condition being discovered by his family and not wanting to disappoint them, he will need to support his learning and adapting a healthy coping mechanism and improving the relationship between him and his family. Interpersonal psychotherapy, CBT, and supportive psychotherapy can can each be used on one person. Interpersonal psychotherapy and CBT can be combined for best results in management of depression and generalized anxiety disorder, as well as other mood disorders, according to Bat et al. 2013. Supportive psychotherapy can be used on patients who have completed the short-term psychotherapies such as CBT and IPT, according to Buckley et al. 2015. I will combine the three modalities in treating the patient because they complement each other. Each therapy continues the treatment from the last, making it a continuous form of therapy for the patient. I will start with CBT, then IPT, and finish the treatment with supportive psychotherapy. Because it's a short-term and a focused program, I will utilize CBT to help the patient learn new coping mechanism and begin to slowly incorporate interpersonal psychotherapy. According to the progress made, interpersonal psychotherapy will be incorporated to help the patient learn to communicate his feelings and express expectations to his family members. I intend to treat the patient using both modalities for a period of 6 to 10 weeks, and then continue the rest of the treatment using supportive psychotherapy to enforce the new skills of coping mechanism and communication. Both CBT and IPT will assist the patient to learn how strategies in coping with his problems. The three treatment approaches will utilize some parts from culturally specific strategies to address the stigma of African American beliefs towards mental health, specifically the Coping with Depression (CWD) treatment course, according to Ward and Brown 2015. The treatment approach will not be purely based on culturally specific therapy because the client does not identify with most of the African American cultures. Strategies for dealing with family and thought behaviors regarding the preservation of the father's legacy will be explored during IPT and supportive counseling. Combining psychotherapeutic approaches to treat depression and generalized anxiety has been found to be effective in a long-term management of the condition, according to Bet et al. 2013. CBT and IPT in particular have been recommended in various guidelines as the best choice of therapy, according to Bet et al. 2013. A previous study found it would take over 300 years to identify personalized treatment for depression, suggesting the need for combining several therapeutic approaches, according to Kogers et al. 2016. Supportive psychotherapy integrates various approaches, including components of IPT, and CBT to help patients adopt healthy behaviors, according to Buckley et al. 2015. Completing the treatment with supportive psychotherapy will sustain the patient's ability to maintain the healthy behaviors during CBT and IPT. The three approaches will therefore ensure the best outcomes for the patient. The next three segments will involve therapy appointments, beginning with CBT to help the patient change his thought process. The second segment will involve IPT to help the patient develop an open relationship with his family by communicating his fears and expectations to them. And the final segment will be supportive psychotherapy, involving developing a supportive relationship with the patient and helping him adapt and sustain the new changes. So as we discussed, I'm going to start with CBT, cognitive behavioral therapy. There's some things that are real basic when it comes to cognitive behavioral therapy. So everyone has a certain amount of stress and has to deal with difficult times in their life. But making a choice to deal with these things in a positive way will help you feel good about yourself. When you think positively, you will be happier and have less stress. How you think affects how you feel and how you behave. Does it make any sense?
Yes, it does.
Now think about how you feel and which leads to how you behave. So this forms a triangle which talks about thinking, feeling, behaving triangle. Many times there is a trigger event that starts the negative thinking. The question is, how do you feel? What leads you to think in a negative way about your situation, about this whole event that brought you in? What leads you to the thought process of the negativity?
Well, I feel that my family um, don't support me in everything that I do, and it kind of makes me withdraw from them. Maybe um, me living apart from them for a while, and sometimes when I come to get them involved in my activities, they don't seem to agree at all times. And I'm a very, very positive person, I must tell you. Maybe I like things to be done a certain way, and we tend to disagree.
Okay. So, how about you use a different approach towards that? Think a little bit more positively. Maybe they are not understanding what you're saying. Maybe there's a breakdown in communication. And so you think about it in a different way. How about we approach it in a more positive way? Think about more positive ways of approaching them instead of just withdrawing. Think about other things that can help you cope, like guided imagery, mental imagery, meditation. Think about walking away from an argument. Think about looking at things from a different way, from a different angle, instead of making that conclusion that the person is coming from a negative angle. So that way we can change the thinking, the feeling, and the behavior. So instead of you thinking of them as stressors, why don't you see them as family and see them as a social support by communicating with them how you feel? That way you can have a better outcome.
Okay.
So, what are other things that stress you out in your family? How about your past? Tell me more about your previous marriage.
Well, my wife, she was a heavy stressor when it comes to my business and activities. It's not something I would like to go into in details, but we had a lot of misunderstanding, and we tend to argue a lot, and we never tend to reach compromise.
Okay. And did you ever see yourself as um, part of it, or you seem to be pointing fingers at her? Did you ever see anywhere you were wrong or anywhere you could have done things better?
Yes, when I reflected on what actually happened, some of it was my fault. I was always trying to look for perfection, and I didn't see my shortcoming. And now I know I'm trying to live a better life and have a more positive way of handling situations.
Very good, very good. What makes you think of you being a failure?
I won't say I'm a failure per se, though, but I have a certain way I would like to do things, and when people don't agree with me all the time, it kind of push me away from them, and I try to do it by myself.
And also, I would like to find out You were concerned about family legacy. So is his, you, there's an expectation you're trying to meet up